Well, good afternoon, everybody. Welcome to the ACRS New South Wales Chapter's e-mobility forum. My name is Nick Timms. I'm the chair of the New South Wales Chapter, and it's really terrific to have so many people here in person and also online for this event. We've got 5 speakers, so I'll get pretty much straight into it. We are, for those of us that are here, as a matter of fact, we're only a few hundred metres away from the new Gadigal railway station. It's a shame that it's not open. But we acknowledge and pay our respects to the many First Nations of Australia who continue to be the sovereign custodians of their countries and the sovereignty of the Maori in New Zealand. And we do also recognise the fact that Aboriginal and Torres Strait Islander people bear a higher burden of road trauma and are nearly 3 times more likely to die in road crashes than other Australians, and are disproportionately represented in passenger and pedestrian fatalities. The e-mobility forum, we have 5 presenters today. Phil Devon, who'll be coming up to the podium in a minute, from Northern Beaches Council, Mr. Bernard Carlin, Mr. David Beck, Dr. John Crozier, and finally the last leg of our medley relay is Narelle Hallworth, who's joining us remotely from Brisbane. There may or may not be time for questions at the end. We're going to be fairly tight, but I would invite those that are online to use the chat function, because there is a parliamentary inquiry in New South Wales, which was why we're having this forum. So if you do have any questions, rhetorical or otherwise, or comments, we are interested, because it might be something that we hadn't thought of. I'd like to acknowledge the NRMA who supported this forum, and also thank our guests and our presenters, and hope we enjoy the networking session later. So Phil, would you like to come up to the podium, please? Prasanna will get it fired up.
Use the arrows up, down.
Good afternoon, everyone. I'm Manager Transport with Northern Beaches Council. If you'd asked me 5 years ago what an e-bike was, I would have just responded, it's the crazy things that Domino's use. In the last, I suppose, 3 years, they've become a significant issue for my team to deal with, who 2 of my road safety officers are here today as well. Sorry. We've probably taken a bit of a leading role recently in dealing with what everyone colloquially terms the fat bikes, where you get 3 teenagers and a surfboard going down the footpath at high speed. Given the demographics in our area, we get a lot of complaints around inappropriate use. The team has also run, I think, 4 I wouldn't say workshops, interventions with the Hire Patrol down in Manly, with mixed degrees of success. The biggest issue we had was actually working out what the issue was and how to address it. The issue that was brought to our attention through the elected council was we needed to audit historical shared paths, work out what the infrastructure we could provide to safely enable e-bike use. They hear e-scooters, whilst not legal, are also in the mix. We're also lucky to have electric skateboards, monowheels. Basically, if you can ride it, the people on the beaches are using them. We had a serious incident, I suppose 18 months ago now, where a lady was bowled over by a monowheel, who asked her if she was all right, then got back on it and rode off. And I think she spent about 6 weeks in hospital recovering from the injuries. One of the biggest issues that we get time and time again is the kids are basically riding what's a moped generally. A lot of them are savvy enough that they've modified them so the speed limiting devices don't work. I think average speed, when we checked speeds as part of this project, was around that 20 to 30, which, in Manly, the speed limit on those roads is 30 anyway, so they're doing similar speeds to what they are on the road. Where the concerns were, we picked up some peak speeds of 50 or 60. Now, an e-bike, one of the fat bikes, hitting you at 60 Ks will do some serious damage. Luckily, we haven't had that issue. In response to the issues that were raised, we went out initially with a campaign before Christmas aimed at the parents. You know, you're buying your children something that's quite a dangerous article if incorrectly used, because our fear was that, you know, given the socioeconomics of our area, we were going to see an explosion. Now, the road safety ladies had shown me a video that they'd picked up from YouTube where there's probably about 150 to 160 e-bikes, majority of them fat bikes, at one of the high schools. Now, you think about 1,000 kids, 200 of these bikes, all leaving at once. It's mayhem. What we did was we engaged a behavioural research firm to actually do some focus group research to determine whether we were going down the right path with a regulatory approach. What was found was a lot of these kids don't actually know the road rules because they're below that 16 years old. You know, mum or dad or both are buying them an e-bike so they can get around the neighbourhood, but no instruction, no road rule knowledge. The second part of what we did was actually go out with what we've called the e-bike code, which is basically just a social media campaign to drive some knowledge into the kids around, okay, if you're on the shared path, ring your bell, you know, give way to pedestrians, all that sort of thing. We'd use the safe systems approach. So this is, you know, the safe people part of that program. What we found was we were starting to get a bit of cut through with the schools as well. One of the local private schools are actually making the kids do their ELS test online before they're allowed to ride their e-bikes to school now. Now, it seems something simple, but it's actually having that benefit of the parents are aware that the kids are now being looked at, so that the parents are now starting to reinforce that behaviour at home as well. What we did, September last year, we had a council resolution to address these issues. We launched a media campaign in May this year. I think council probably has spent about $50,000 or $60,000 on this overall program. It ran for 8 weeks. We got a lot of positive feedback. What we looked at was the key issues. Now, we did get a few angry residents saying, you know, we're wasting our money or wasting their money on this program when they should just be banned. Now, some of them are legal, some of them aren't. What we need to do is actually probably provide a better regulatory environment for them to operate in. I've actually been personally on site with Highway Patrol when we've been doing these joint operations down in Manly, identifying what's a legal bike and what's an illegal bike. Unless, you know, you've got the LiDAR, obviously, but where you've got but we sort of I've had a real pop up on the screen. one of the issues that we had, one of our shared paths runs through an unfenced dog park. So what we found was that you had bikes, and down there they were doing over 30, slightly downhill, they're picking up. So there's also that, the minute there's an incident with a cyclist versus a pedestrian dog, put those along key locations, they actually started growing legs and moving around. People were moving them to where they thought there was an issue. Okay. I know my team that are here today, they probably spent a day a week going and finding them and relocating them to where they should have been. All right. We've been working closely with the schools to various degrees of success. The interesting one was the local bike shops. Obviously, it's in their commercial interest that they're working with us very proactively. You know, the collateral the ladies have been distributing, that's been handed out. They've been loaning us various e-bikes for events, for making the videos. This is what these are the stats from our campaign. So we reached 3.29 million views. So that was paid media, the mainstream media, social media, across all of our channels. Given the fact that the population on the beaches is 250,000 residents, we've actually reached more people, I think, with this campaign than any other campaign we've run in the past. The media coverage value to the organisation, or you know, the differential spend,
Sorry, keep going.
was to the tune of $750,000. There was positive media. There was also mainstream media. We did a media launch down on the Corso that was attended by every mainstream media organisation in Sydney. Okay. What we found was people were actually stopping to hear what was being said on site. I couldn't get the video to play when I tried it. Do you want to see if you get
Yeah.
Yeah, see if it'll work. No.
Yeah, no, sorry.
No, when the embedding is working.
Yeah.
So we did two versions of the video. I'll talk you through it. There was the e-bike code video, which is the one on the left, but then also the rider's point of view, because what we found from the initial research was that the kids were reasonably oblivious to what the issues were that they were creating.
Sorry.
Okay.
Just having some trouble with the online. They're saying they're not getting videos coming through. Sorry.
One of the things that we found was where we'd put up the core flues, whether they be the full size, the A3s, there was a QR code on them. 30% of the traffic that came through the website was driven by those forms of engagement with the community. One of the key things was when we started doing the e-bike code development, trying to get buy-in from our executive, because it was something that was quite simple. they were concerned that it was going to miss the mark. Well, clearly the development of the program worked because we had more cut through than any other program that we've developed. These are the full-size cutouts. I know the older lady in the middle, she was seen just about everywhere across the beaches, and she was quite mobile for someone of her age. She'd made it all the way to the deep west at Forestville, where I live. Also up to Terry Hills around the skate park. The dog travelled fairly well too. His favourite haunt was actually on top of the 30k speed signs down in Manly, because he's a smaller cutout. It was easy to lift up. Okay, that's the level of saturation we used down in Manly, where we had probably a 25% reduction in the number of complaints in the 8 weeks. So there was working anecdotally from the complaints that we were getting. We also used print media, bus stops. We specifically didn't use bus backs in this campaign. In previous campaigns that we've run, we have. There was an issue with timing and whether it was actually the right media. The ladies have been out engaging with the schools and the bike retailers, as I mentioned. They're highly supportive of the program. And it just goes to show what can be achieved when everyone starts working together to get an outcome. That's actually the end of it, Mick.
That's it.
So I tried to time the 10 minutes perfectly.
Thanks, Phil. It's fantastic just trying to get everybody running to time. Mr. Bernard Carlin, Centre for Road Safety and Centre for Maritime Safety. The floor is yours, sir.
Excellent. I know Mick has already paid respects to the people of the Gadigal land, and so do the same, and also note the trauma impact on Aboriginal communities across the state as well. I'm going to give you a bit of an overview of the sort of active transport context, a little bit of a history of that as well, because it's really important, I think, in terms of being able to manage the trauma associated with both pedestrian and bicycles currently in New South Wales, and then the development of e-micromobility. And we have some examples to follow and in the other jurisdictions around the country as well, who are slightly further advanced in their policy framework and in their regulatory framework compared to New South Wales. I think it's really important to say up front that the New South Wales government is committed to both active transport, but exploring the e-micromobility as well, essentially around that efficient last mile freight option, delivery of sustainable outcomes, linking people to their communities and public space and town centres, helping people connect to public transport, and support that sort of social interaction in outdoors, delivering wellbeing benefits. And I think in the active transport space, that's a really critical health outcome. And I note that it's contested in the micromobility space because of the active transport of people actually engaging in cycling. Really important, I think, to note as well that since the late 90s, we've had power-assisted pedal cycles defined as bicycles. And that's a reality in the regulatory framework across the country. And there's no discernible difference in the crash impacts of people who are riding legal power-assisted pedal cycles or pedelecs that is of any note. But what I'd like to, just to remind people of as well is the 53 fatalities that we have for bicycle riders and the 9,536 serious injuries where people are admitted to hospital from having a crash on the road associated with cycling over that 5-year period. I'd also note that the vast majority of those pedestrian fatalities have been in the 60 and 70 age groups upwards. So, the older part of the community. And so that's a really critical thing for us to be thinking about from a safety perspective. But also the greatest number of serious injuries for cyclists don't involve other vehicles. They involve actually cyclist crashes where there's not a motor vehicle involved. And so, there's also that context of how the trauma is manifest on the network as well that we need to be thinking through in terms of prevention. And also noting that, we're attempting to reduce the amount of trauma from active transport. So when we then start to think a little bit about the law and where we're up to in terms of the framework for the regulatory framework, I think it's really important for us to be absolutely clear, because I know that the public commentary on some of this is that, we don't really know what the law is, and it's a bit vague around e-scooters or e-bikes. So, electric powered assisted bicycles up to 500 watts in New South Wales. Power output progressively reduced as speed increases beyond 6 kilometres an hour. So you can actually ride one under throttle up to 6 kilometres an hour. And then that must cut off and the bicycle reaches 25 kilometres an hour. So you're being assisted by pedalling between 6 and 25 kilometres an hour before it cuts off. So, in terms of being able to spot a illegal e-bike, essentially if somebody is riding an e-bike under throttle at 20 kilometres, 10 kilometres, 30 kilometres an hour, over 6, not pedalling, then it's illegal. So it's pretty simple from that perspective. And then we have power assisted up to 200 watts, which cannot be propelled only by the motor. So you must be pedaling and must weigh less than 50 kilograms. So that's been in place in one shape or another. There's a slight change in the watts in recent last year or so, but it's been in place since the late 90s. And really, as I said before, not really having significant impact in trauma associated with bicycle use. E-scooters, so privately owned e-scooters can't be used on roads or road-related areas in New South Wales, including footpaths, shared paths, cycleways or cycle paths. If you buy one, you can use it on private land, but you can't use it on any public roads. Other than the hired shared schemes, which have been designed and run in several local government areas over the last 2 years in New South Wales, including restrictions on those, the use of the speed, the age, safety conditions, geofence, speed limiters, as I mentioned, and age restricted. And when we look at the data associated with those schemes, fairly low incident numbers and also very low trauma outcomes associated with those schemes. Note even in New South Wales over the last 2 years, there's been 4 fatalities on illegal e-scooters. And so, there are trauma outcomes in the use of these devices, which we need to be aware of as well. And I just note, we can learn from the experience of other jurisdictions. The Queensland's identified that the number of hospitalisations from e-scooters has actually now exceeded the number of bicycle rider hospitalisations in Queensland. There was a significant increase, around 700 hospitalisations in the Victorian trial period for e-scooters as well. So we need to be thinking about how do we design a system that has low trauma outcomes so that we're enabling people to get around safely on our networks. Certainly, I think one of the issues that we need to be thinking about, of course, is the age of users and their capacity to understand the rules, but also be able to navigate safely in the right environment. So we need to examine, I think, e-micromobility devices in their own right. They have different dimensions of operation. So, riding a bicycle at 30 or 40 kilometres an hour is a totally different dynamic proposition to compared with riding a motorcycle or riding an electric e-scooter. And so we need to, in designing how we manage the risks associated with crash risk for the use of these devices, we actually need to be thinking very clearly about the dimensions of the environment they're being used in, and the way in which we might standardise the design of those vehicles for use in an appropriate location. And so I think some of the risks, some of the issues that we're coming to grips with include the ease of illegal modification of some of these devices as well. So we took, I think it was 4 of the e-scooter devices out to Crash Lab to just check how quickly you could modify the speed on them. I think 2 of them took, I think, 4 minutes to actually adjust to maximum, the speed up to 70 kilometres an hour, and the others took 10 minutes. So I think the issues around how we manage the vehicles which are being used, which are high speed and high risk in the road environment, like primary issues to come to grips with in any regulatory framework that we design for the future for the safe use of our road network, including these sorts of e-mobility devices. We can learn a lot from those who've gone before us in, as I said, in Queensland and Victoria, South Australia currently, in terms of travel speeds. The Queensland example, they started at a speed which they then, a couple of years later, have actually halved the speed that the vehicles are able to be used at, because of the trauma outcomes that they've been able to assess. And so rather than going through that experience ourselves, we can be learning from some of these other jurisdictions. Note the importation laws around these vehicles being able to be brought into the country and sold. So, for 3 years ago, I could have gone to Macquarie Park and actually purchased an e-scooter off the floor that does 70 kilometres an hour. Pretty much, no information there at the sale of that device that would say that that's not able to be used in the road environment. And the device at 70 kilometres an hour, it's not safe to be using on our road network. So we have approached the federal government around what is it that we can do to restrict those unsafe vehicles that are actually being sold in our marketplace, talking to Fair Trading in New South Wales and ACCC around how do we manage that process, because clearly that's one of the barriers to moving forward to have safe e-mobility on the network as we seek to change the way in which people are moving around. I think one of the other key issues is where these devices are being used, footpaths versus shared paths versus cycleways on the road. We need to be thinking through the implications of mixed use of locations, not just for the safety of pedestrians in one context, but also for the vulnerability of the user of the e-scooter in a road environment with high speed vehicles travelling on it. And so finding separated and developing separated infrastructure is going to be an absolute key to the safety of these road users in future. So some of the challenges which I think we need to come to grips with around designing a safe system to limit as we change the mode that people are travelling, is to make sure that we're putting a regulatory system in place that minimises the chance of that actually adding to our road trauma, because as we all know and we're all attempting, is to move towards zero fatalities and serious injuries. Thanks.
Thank you, Bernard. I'd like to now call to the witness stand, Mr. David Beck from Transurban, to talk about the perspective of a road operator.
Thanks. It's been a while since I've been called to the witness stand. Hi everyone. I'm David Beck. I'm the Road Safety Technical Manager at Transurban. For those that aren't aware, we own and operate a lot of the toll roads across Australia along the eastern seaboard and also North America. And my role is to work across the markets to maintain and build on already very high road safety profile, and also to share the learnings that we have. So that's what I'll be doing today, sharing some learnings that we have about e-mobility on our roads. The big issue that we're seeing is about e-bikes on our roads. And in particular, we're seeing that a lot of those e-bikes are related to an increase in delivery riders using them on our roads, particularly in tunnels where they're prohibited. So they shouldn't be there. But to give you an overview, lay of the land, this is the networks that we own and operate across Sydney. And the dotted lines are the ones, are the tunnels that we operate. And that's where we're seeing a lot of the issues, particularly in the urban area close to the Sydney CBD. That's where actually, in our investigation, we found out that's where the delivery platforms use two-wheel delivery modes. And so that's where we're getting a lot more e-bike incidents in our tunnel. So that'll be Cross City Tunnel, Eastern Distributor, and parts of West Connect that are closer to the urban areas. Yeah, so this is just a rundown of those. But yeah, these two locations here are the two main hotspots that we're seeing right now. They are part of West Connect, which is a relatively new piece of infrastructure. And that might be reasonable because some of our pre-existing assets, we have had issues there, and we've addressed it with signage and discussion with delivery platforms and education campaigns. We've seen a bit of a drop-off in those, and then we have a resurgence with other ramps as we bring on new infrastructure. So they're the locations where we're seeing the greatest issues at the moment. But in general, in our inner city motorways, we're seeing 4 to 5 incidents per month per asset. And as mentioned, a lot of these are delivery riders. And what we've found, and also with discussions with delivery platforms, a lot of those delivery riders are foreign students. And that's important because a lot of them don't speak English as a native language. And the regulatory signage to advise not to be on the road is completely text-based. You've probably seen it, no cyclists, animals and pedestrians on this asset. And so if English isn't your native language, that could be a problem. I'll show a video of what we're seeing on the road, and then I'll provide some takeaways from that. Yeah. So yeah, a few takeaways from there. Firstly, there's the inherent risk. We operate a high-speed, high-density environment with a lot of freight movement on it as well. So it's not really a place that cyclists should be traveling on. There are a lot safer routes out there. There's also the incident, you saw a few where they're traveling the wrong way, which adds to that. And then you have cars, you have the disruption to the traffic flow that has flow-on effects. So you have if our traffic control room operators identify that there are cyclists there, incident response will go out to safely remove them. But in doing that, we're going to close the lane, we're going to reduce speeds, and that leads to issues, an increased risk of rear end crashes occurring. And then you'll also have drivers trying to maneuver around cyclists and encroaching into other lanes, and that can lead to near misses as well. So this was from that video, but just gives an idea. As the car is moving away from the cyclist, with the focus being on that cyclist, it almost swerves into a motorcyclist with a truck right in front. So it's not just about protecting the cyclist, and that is a big issue. It's about protecting all road users. Yeah, so we've had discussions with delivery platforms about this, and what we found from them is they provide in-app navigation for their drivers. They do not provide in-app navigation for cyclists that use their platform. They actually require them to move to a third-party app of their choosing. So it might be Google Maps or some other platform. And that means that there's no real control to make sure that they're actually using a navigation system that's aimed at cyclists. So they may be using Google Maps and whether intentionally or not, using the navigation tools for drivers. So we're doing a lot to educate drivers around this. This includes media articles and interviews, and also paid advertising through social media, through YouTube ads. You know, we are aiming for a younger student demographic. They're really the ones that we want to target. So they've been very effective. And the message is really simple, telling them to use a navigation app on cycling mode, and that'll navigate them away from our tunnels and our infrastructure and to much safer environments for cyclists. It's been really successful. This was a campaign we did during National Road Safety Week, and you know, we had millions of views, over 1 million on YouTube, over 2 million on social media. So it's been really effective in that way in raising that awareness. But as mentioned, a lot of them are foreign students, so some will leave and new ones will come, and you know, it's a pretty itinerant demographic. So education needs to be ongoing if we want to have an influence there. In terms of some on-road interventions, I mentioned text-based signage is an issue, considering the people that we're finding are using it. So it's very important for us to add on and replace the text-based signage with symbolic signage instead. And that's really easily identifiable and understood by everyone, including native English speakers. So it's very effective for the really, for those areas where people might miss that signage. Then pavement marking as well is a very effective tool to alert them that they need to avoid this road and go elsewhere. I mentioned that our traffic control room operators identify the cyclists through video. We've got excellent eyes on the road through CCTV, but that involves people actually noticing what's going on. So another tool that we're trialing and looking to expand is thermal detection, and that's been very good at automatically identifying when there's cyclists being on the road, and then traffic control room operators can verify that, and it leads to much better intervention times. But yeah, it's quite a challenge, but I'm happy to have discussions with people afterwards about any other learnings on this as well. Thanks very much.
Now I'd like to call upon Dr. John Crozier to give his presentation from the trauma perspective.
Mick, thank you very, very much. And from the privilege of the position, I'd like to commend both Mick and Rosanna for the facilitation of this important meeting today. It is a privilege to speak to the topic of e-mobility injuries. I do want to also highlight the advocacy that Harold Scrooby does pay on behalf of us all as pedestrians, and the encouragement of active forms of mobility.
Just the arrows up and down should work. Sideways.
So in the next 10 minutes, what I'd like to do is contextualise e-mobility injuries, talk about mechanisms of injury, give some reference to the patterns of injury that we see within the hospital environments, acknowledge international trends, and point to emerging Australian trends in injuries from e-mobility devices, and finally conclude with a few comments. We are bipedal mammals as a species. We've been present probably for a little over 200,000 years. Within less than a generation, we've seen the emergence of a range of devices that now add to the trauma burden. On Monday of this week in my hospital, we had 56 more patients within a 900-bed hospital than we actually are staffed for. We had 90 patients in the ED, 46 awaiting beds. We were creatively using the discharge lounge. We had 10 ambulances ramped with one patient over 1.5 hours post-trauma on that ambulance. That is but one hospital, and that is the standard throughout the hospital system of Australia. We have a silent epidemic of death on our roads, which has risen 15% year on year in New South Wales alone, and we have over 50,000 hospitalisations currently from road crash injuries. Now, against that context, this is the emerging trend of another epidemic. Count how many crashes occur. These are low-cost actual tests. I'm going to invite you to watch in slow motion now and count the 8 crashes, curbside impacts of a commercially operated, freely available scooter. Young lady, young male, 2 on that. She's observed the ramp. He hasn't seen the curb. Now that clip is freely available on ABC Online. I've slowed the second half of it down to invite you to consider what injuries do you think each of those impacts have caused. Now, this is a referable peer-reviewed paper on what injuries are the most common, scooter-related, requiring surgery. This paper highlights 23% upper, 45% lower, 13% involving and 19% injuries to those parts of the body that orthopaedic surgeons see. And that's an orthopaedic paper that will give a biased impression of the injuries that are actually more likely to involve disfiguring craniofacial injuries or produce traumatic brain injury. And these are open sourced images in the main. The one to your right is from an image of a male managed recently in Liverpool hospitals. This is the quality of CT imagery that we can take for granted. But you can see there's an image evidencing injury around the orbital margin here. And then as we go, there's a depressed fracture involving the zygoma. He has double vision because the globe has been disrupted, the axis of the globe. And that will probably produce a permanent anaesthesia and possibly disconjugate gaze for the rest of his life. This is another male recently managed. You can see the contusion on the skull, non-protected by helmet, and a linear fracture. These will frequently not present to the hospital system, but the complicated orthodontic work you've had done on your child in a single impact is thousands of dollars later needing repair. These upper extremity injuries in the main are open sourced from litigation in the United States. Here is a post-surgical repair, standard ulnar fracture with the orthopedic fixation and a complex surgical repair. A distal radial fracture, again, open reduction, and many days in hospital. This is an elderly woman who tripped on a discarded e-scooter, complex wrist fracture, and quite a disabled lady for quite a long time. This elderly woman, fairly osteoporotic, not much mineral in the bones, low energy impact as she fell on a discarded e-scooter. The lower extremities, here we see soft tissue abrasions, pretty frequent, easy to understand. Here, a ruptured tendo Achilles. These are more graphic lower extremity fractures of the ankle. This is compound with a bone exposed. Here we see a male post-injury, a very displaced complex ankle fracture requiring complex orthopedic surgery, hours and hours in the operating room, and months before he has any semblance of normal walking. This is again an injury in Liverpool Hospital recently, swollen knee, very complex through knee fracture with many of the joint surfaces discongruent, and again, complex orthopedic surgery, months affecting meaningful walking. As is common in road crash, the key energy is kinetic energy, the pathogen. And the critical part of this is the exponential nature that velocity brings to the propensity for injury. So if you double the speed, you'll 4 times or quadruple the potential energy available for injury. I showed you low-cost dummies, low-cost tests involving humans. These are much higher cost tests that can be more frequently and accurately used to replicate and get a better understanding of the science of the impact forces involved. This is a 25 kph impact. I've slowed this one to emphasize the weight of the skull and brain, about the weight of a bowling ball, 8 kilograms. It takes a hell of a force to produce that bullseye fracture, that pattern on the windscreen of a car. And you might appreciate some of that tempered glass spalls with the impact force of the head on it. Now, again, we've used finite element computer simulations to get a better appreciation of the sorts of injuries likely to be produced. Very sophisticated models here of these computer simulations. This is an European pattern of passenger vehicle. Progressively, our fleet has seen larger mass vehicles with a less favourable pedestrian favourable front surface. And I make reference to the Dodge type vehicles, the SUVs and utilities. And again, the impact forces on those disproportionately injure vulnerable mobility riders. Again, the science of understanding, it's pretty chilling to see the amount invested in getting an understanding of these injury patterns. So I won't further labour the point, I will make the key point though, we have a high understanding of the kinematics involved in the production of a lot of these injuries. With a real world experience, in a single year in 2 centres in Southern California, the patterns of injuries involve bone fractures in 40%, head trauma in 30%, and cuts and sprains in 27%. The majority of those injuries are sustained in falls, 80%, 11% collision with objects, and 8% hit moving. This is a further concatenated summary of the whole of the United States Medicare type data from 2014, and there's an exponential increase to now in 2018, 19 per 10 to the 5th injuries from e-scooters. And again, disproportionately a third head injuries, a third lower extremity, and a third upper extremity. That's a key statistic. This is a quick one for you. Something has happened in Paris between 2017 and 2019, sorry. And we see in light blue dental injuries coded here, and in a darker blue, the craniofacial and maxillofacial injuries. What's caused that uptick from late 2018? That's when e-scooters first began to trade in Paris. Now, not long after this, the public were invited to vote on whether commercial operators should retain that privilege in the precincts of central Paris. Overwhelming the population voted against, and there was a sharp decrement then as those commercial operators were required to vacate Paris. Other countries evidenced the exponential rise in burden once the commercial operators began to trade. This is a Swiss experience from May 2019 to October 2021. And again, this statistic, 43% had alcohol effect as part of the covariable of the injury matrix. Let's turn now to Australia. What do we know in the Australian environment? Well, here we see a single year's experience in the Royal Melbourne Hospital, and I commend David Reid, the Director of Trauma there. But end January 2023, we had 256 electric scooter-related injuries, 247 riders and 9 pedestrians. Alcohol reported by 34%, disproportionately male. The average, or a total of almost 2 million was spent on managing those 256 e-scooter injuries. And I can tell you the budget would not have anticipated that burden of injuries in that 12-month span. In Queensland, in 2018, and again, I commend Harold Scrooby for his participation in a College of Surgeons Trauma Committee. Harold had made us aware of the potential for this pattern of injury from e-scooters before a commercial operator began to trade in Brisbane. So we were able to get prospective studies going in emergency departments, and patients were being coded whether their injury was from an e-scooter type mechanism. From 2019, as an entity began to trade in the CBD, there was, as I say, an exponential increase in the burden of e-scooter related injuries presenting to predominantly in the dark green here, the Royal Brisbane Hospital. But you'll note also in the latter part of 2020 and so on, there are 4 or 5 other hospitals in Queensland that are also showing these increasing presentations with e-scooter injuries. And common alcohol use, the absence of wearing a helmet, the incorporation of speed, and this is the key, the poor documentation. Unfortunately, humans, we're fallible and we're actually very, very poor at documenting a lot of stuff. So to discern retrospectively whether a presentation is from an e-scooter related pedestrian stroke or rider or pillion is actually fairly difficult. We are using AI to try and retrospectively glean from text fields in the ED triage. This is Liverpool Hospital's work, and I commend our data managers, Melissa Murphy in particular, who's maintained an Excel file from 2020 to 2024. And again, the blue is the summary, if you like, of the variety of injuries. But in that 4-year span, we've had an exponential rise in e-scooter or e-mobility related presentations. I'll close now. I want to pay particular praise to the Jamison Trauma Institute, Kirsten Valmore, the data scientist / analyst and leader of the team, and a range of the ED physicians and surgeons. This is a portal, open, freely accessible and interrogable. I've left the hyperlink here, but it does a great job of showing the scale of the rising trend of injuries, e-mobility related, a breakdown of time of day, patterns of body injury. And the BI interface is very easy to interrogate. I do want to note, independent, want to praise the work that Bernard Carlon's unit does in the Centre for Road Safety. And I think the jurisdiction has a lot to be proud of in its ability to paint in a very, very easily interpretable way for the person with interest. This sort of data, which should be open, it should be available, and it should help a range of people working to mitigate the harm. I'll make reference to a recent talk in Texas, micromobility regulation, best practices review, scoot now, regulate later, was the theme of the topic. I think that's fairly propitious. A lot of these variables relating to the device and also the injured person are not well coded for or collected. So these are a range of data points that it would be good to see collected prospectively. And the final points that I'll make, these good summary statements, I think, are the ways in a collaborative way we can work our way forward. We need much better detailed crash data, and those discussions with the officials, relevant health, legislators and other officials in combination with the operators. And they do need to be facilitated because there's potential for a lot of vested interest and fiery interactions. Filed lawsuits are really good. And again, the nationwide scan of lawsuits in the States has been pretty helpful. Insurance requirements, again, that's where we've got to spend a lot of time, particularly with our commercial operators, working out who pays once the profit has been made and pieces are picked up. Terms and use of liability, again, legal analysis of service agreements. And then I'll finally close. I wish the audio would play, but you'll get. And on that note, Mick.
Well, finally, I'd like to introduce Professor Narelle Horwath, who's appearing remotely live from Brisbane, and hopefully the technology gods will be smiling.
Thank you, Mick. And I'd like to give a presentation from the researcher's perspective. And Prasanna, if you could start that presentation, that'd be great.
Second. Could we just test your audio again, Narelle?
Okay. I'd like to give a presentation from the researcher's perspective. Is that coming through?
It is not, but please give me 1 second.
Okay.
Whatever can go wrong will go wrong, isn't that right? Can we try that again, Narelle?
It's Narelle here. Can you hear me?
Yeah.
Okay. Hi, Narelle.
Great. Thank you. Okay, I'll try and go through this as quickly as possible. So it's basically a researcher's perspective. Just keep going. Next slide, please, Prasanna. And clearly there's lots of different types of devices, which are micro-mobility, and the number of different types of devices is going to keep increasing. Today, I'll really only be talking about e-bikes and e-scooters. Next slide, please. So e-bikes, and I'll call them conventional bikes. I think we have to distinguish between the e-pedelecs, which are reasonably well regulated, and what I call motorized bicycles, which are illegal e-bikes. Certainly, e-bikes have their advantage. US data have shown us that people in shared schemes much prefer to use the e-bikes than the conventional bikes. And for private uses, people on e-bikes ride further. And the health benefit of an e-bike is roughly half of that of a normal bike. So they do have a health benefit. Certainly concern in the Netherlands now that children are actually riding e-bikes to school, and a few worries about that. But there's been very little Australian safety research. And I think one of the reasons for that is that they're not coded separately in the crash data. And as time goes on and e-bikes are being developed, it's really so much harder to tell them apart when you're actually looking at them. And certainly some of the research has shown that we've done is that certainly the delivery riders are more likely to ride e-bikes than conventional bikes, and they're certainly more likely to ride those illegal motorized bicycles. Next slide, please. So here's data we collected in the Brisbane CBD over a period of 11 years. And the private bikes are in the blue, and you can see them, they'll be mostly non-e-bikes, and they're the majority of the two-wheelers. The shared bikes came from, in the yellow, came from from 2012, and in the last year they were actually electric ones. But what I'd like to point out is the grey, the private e-scooters. You'll see that from 2019 when they were first introduced through to later in the year, let's ignore 2020 because that was COVID, and to 2021, the number of private e-scooters is really rising much more than the number of shared e-scooters. So I think that's one of the things that people certainly seem to be preferring, the private ones. If we go to the next slide, then clearly we've got differences between e-bikes and e-scooters. The differences are in the vehicles. The dynamics of an e-bike and an e-scooter are very much different, and that small wheels are a problem, and the tipping and so on. The users are a different population, it seems. And also the rules are different. And I think that's one of the challenges. So let's go on and to look at not the people on the e-scooters, but the people walking on the footpaths. So there's a major concern for older pedestrians and those with disabilities. And some countries have brought in speed limits on the footpath of 6 kilometres per hour, which is basically walking speed, but it doesn't seem to have made any changes bringing those rules in. In Brisbane, we observed that about 40% of e-scooters and bikes were ridden within 1 metre of pedestrians on the footpath. But less than 2% of the time was there an actually observable conflict. So I think that's reflects Brisbane, where in a sense we are somewhat used to, because it's been legal for both types to ride on the footpath. Yes, but it is a big problem. We don't have many injuries reported, but certainly we certainly don't want people being scared about walking on the footpath because of the potential for injury. So what can we do about it? Next slide. This shows some of the same data from a previous slide, but actually broken up in terms of sites without a protected bike lane and sites with a protected bike lane. And so having a protected bike lane takes people off the footpath. So that's an important thing. If you put in a protected bike lane, e-scooters and bikes will get off the footpath. Next slide, please. This is wider across Brisbane data collected by TMR. And it's actually the speeds on the footpath. And this was in 2022. And what you'll notice is that, and this is just for the e-scooters, actually, despite the picture that, yes, the picture shows it. And consistently, the e-scooters do actually ride slower on the footpath than on the road, which is a good thing. But you still are seeing, speeds above 10 and 15 kilometres per hour. So they're slower on the footpath, but it's still not slow enough. Next slide, please. Okay, I think John covered this very well. Let's go on to the next slide. Okay, so we've got shared and we've got private e-scooters. They're very different, and they have different outcomes. The advantages of the shared e-scooters compared to private are you can effectively limit their speeds, and you can geofence and time control their speeds. So you can actually adjust the maximum speed they'll travel at depending on where they are and when they're being ridden. And you can actually mandate as a council or as a state authority, when you're allowing the shared e-scooters, which particular safety technologies they're required to have, including pedestrian detection, helmet technologies, and so on. Disadvantages of the shared ones: you get lower helmet wearing, and I'll show you that in a minute, than you do with the private e-scooters. Generally, people riding shared e-scooters are really inexperienced, so they're more likely to make mistakes. And often they're riding for fun, which is associated with a higher level of risk-taking. So that's, in a sense, the comparison between the shared and the private e-scooters. The next slide shows us some helmet wearing data. And this is from Brisbane in 2021. So blue, okay, we've got two panels here. On the left-hand side, the panel is showing about the comparison between private bikes and shared bikes. So for private bikes, we observed about 97% helmet wearing rate. That's worn and correctly fastened, legal behaviour. For the shared bikes, it was down a bit below 70%. And for those shared bikes, because the shared bikes had to have a helmet provided, then the helmet was often there on the bike, but not being ridden. When we go to the private e-scooters, to go across to the e-scooter panel on the right-hand side, though, what you'll see is that for the private e-scooters, we've got just over 90% helmet wearing rate. It's lower than for a private bike, but it's still up there. But when it comes down to a shared e-scooter, the helmet wearing rate, correct helmet wearing rate, was less than 60%. And most of those were 30% of the time you could see that the helmet was actually there. It was on the e-scooter at the time. So I think that one of those challenges is people not wearing helmets, but it's a not wearing helmets on shared e-scooters that's largely the problem. Next slide, please. So one of the rationales for e-scooters is actually, from a transport point of view, is actually replacing car trips. When we asked people, and these are people in Brisbane, what what other mode their e-scooter trip replaced, we found a big difference between private and shared. So for private e-scooter use, we found that 45% of the private e-scooter trips were actually replacing a car trip. So it's less than half, but it's okay. But amongst the shared e-scooter trips, 60% of them were replacing walking. Now, that's not good from a safety point of view. It's not good from a public health perspective either. And that's a pattern that's found in many, many countries. So one of the things that we did, given that we've got e-scooter users, we've got e-bike users, we've got pedestrians, what is a safe mix? So if we go to the next slide, we put together a risk matrix. And what we've identified is that there's two main characteristics. One is the operating environment. Where is that mode being used? And second, for the e-scooters and for the bikes, what's the maximum riding speed that they can do? And we use the standard green, orange, red comparison. And we also noted who it was, when it was red or orange, who it was dangerous for. Now, that's something that we developed a few years ago, but we still haven't seen a need to change it. So I think that gives some guidance developed from a safe system perspective as to when are they compatible, when are they not compatible. And that's in a sense, our summarised recommendations. But going on to the next slide, I think that safety on 2 wheels or 2 feet, it doesn't really matter. There are some common things that we need to have. Separated and connected infrastructure, adequate capacity, safe and equitable intersection treatments. Because when it's not equitable, then you get lack of compliance. Lower speeds if the modes aren't separated for motorised vehicles, and smooth and uncluttered footpaths. But e-micromobility has specific challenges. The next slide, please. And one of them is the rapid evolution of the devices. We're getting new things every year. We can't predict what's coming next. And we can't predict what's going to be popular. So planning our infrastructure is difficult in the face of uncertainty about what people will be riding and uncertainty about what might be the regulatory environment. There's a lack of effective import controls, which Bernard mentioned earlier. The regulations vary among cities and over time. So many people who are looking at things on the internet, they're seeing the rules, but it's not the rules that apply in their city. If we bring in tougher rules for shared e-scooters, then we may actually encourage the use of private e-scooters instead. And given that there are real challenges in effectively regulating private e-scooters, that's a problem. We need to be able to regulate their performance characteristic, what they can do, the locations they're used in, and the speed of use of those private e-scooters. They're things that we can do with the shared e-scooters, but we can't do it with the private. And just next slide to say thank you for your time. I've tried to get through that as quickly as possible so that you'll have some time for discussion or whatever.
Thanks very much, Narelle, and I'd like to thank all the presenters. We are over our 1 hour, so I won't hold anybody up, as those that are online will probably need to go about their business and so forth. While I do have the floor, there is just one thing I would like to do. Mr. Duncan McRae, who's joined us tonight. Duncan has been a road safety champion. He's been a previous chair of the New South Wales chapter. He's been a previous member of our committee for quite some time, decades, many years. And of course, he's still an ACRS member. He's still working in road safety, but this year Duncan stepped down from the committee to probably give other people a bit of an opportunity. Duncan, I'd like to call you down here and make a small presentation to you. So, thanks, Duncan. There's a certificate of appreciation. The ACRS. Photo op. I will take over drinks. All right. Well, thank you very much, ladies and gentlemen. For those that are in attendance, our panelists are here and happy to take questions. I see there's plenty of stuff on the chat. We look forward to trying to read that and put a presentation, put a submission together for their forthcoming parliamentary submission. We expect that others within local government, within Transurban, and of course the Centre for Road Safety will do likewise. And I know Narelle is also working on one. I really hope that this afternoon's been of benefit to you. And on behalf of ACRS New South Wales, thank you very much.